Okay, our project is on attention deficit hyperactivity disorder, commonly referred to as ADHD. I'm Emily.
I'm Danielle.
And I'm Leah.
Okay, next. The CDC says that ADHD is one of the most commonly diagnosed neurodevelopmental disorders in children, and it is commonly diagnosed around the age of 7, so early in the stages of being a child. And it does typically carry on throughout your adulthood. And then children who are diagnosed with ADHD, they may have tendencies to have a difficult time paying and maintaining attention on things that are going on in their environment, controlling impulses, and reacting quickly rather than thinking about it. So that goes hand in hand with the impulses. So next, and then a neurological glance of what ADHD actually is. Growing evidence directs to the involvement of the frustrational network as a possible factor to the disorder and the physiology of ADHD. And this network, the frustrational network, it normally diverges into the lateral prefrontal cortex, the dorsal anterior cingulate cortex, and the caudate nucleus. And additionally, in patients with ADHD, reductions in volume have been noted in total cerebral volume, the prefrontal cortex, the basal ganglia, the dorsal anterior cingulate cortex, the corpus callosum, as well as the cerebellum. And then if you note in the photo next to these bullets, the anatomy of ADHD, you can see the shaded areas of where it usually is affected in the reduction of volume in the brain of someone that has ADHD, specifically in the prefrontal cortex. That's where a lot of reduction is. Also, there's been a developmental longitudinal study on ADHD patients, and there was found a delay in cortical maturation, and additionally showed that differential clinical outcomes may be correlated with different developmental trajectories. And past that, so even in adulthood, it shows that there's a reduction. And even with clinical treatments, they can't do anything about it. In studies of cortical development in children, however, with ADHD, a marked delay in brain maturation seen with the development of volume. The gray matter peaks were about 3 years later than in typical cases, so people that aren't diagnosed with ADHD, and the delay was most present in the prefrontal region, so again, in the purple area of the picture of the brain. And it usually affects, ultimately affects your planning as well as your motor planning. So next slide. Even though it may seem a little negative, there are a lot of positive things that come along with being diagnosed with ADHD. Typical traits that can be found in someone that has ADHD is hyperfocus. They also are very resourceful, and they are very fresh when it comes to thinking, and they can be very creative. And with the things in their environment, they know how to think quick on their feet.
Nice. Thank you, Emily.
Course.
All right. So based off of what Emily said, she kind of dived more into like the neuroscience part, but to break down some of the parts, we can start with the prefrontal cortex. It works on affecting attention, behavioral, emotion, and responses. So for a person with ADHD, that can be switched on very easily. For me, I have ADHD, and my mood can literally just be switched by how you approach me. The limbic system helps you regulate your emotions. It's found common in someone with ADHD to have dopamine deficiency, causing them to be more restless and unable to control their emotions and impulsive. Regular activity activating, I can't say that word, system is responsible for regulating sleep and wakefulness transitions. This is being affected can cause hyperactivity, which you see in most ADHD kids. It can be like you're tired or you're like really hyperactive. Scientists also have discovered that some people with ADHD have a smaller sized brain compared to people with average sized brain. I think that's really interesting. Let's see. For symptoms, let's see. I think, Danielle, this is you. Go ahead.
So the symptoms can be obviously many in children and adults. They are lack of focus, disorganization, forgetfulness. I, like Leah, feel like I have it. Sometimes I forget a lot of my keys and such. Time management issues that can arise in completing tasks or schoolwork or, even in work. Along with that comes anxiety, which is a whole circle in itself. And then restlessness and fidgeting that we can see in children a lot.
Doing it right now.
Right? Doing it right now.
Exactly.
And then leaving chores and homework undone, like I said. And then in some people, even aggression, I think, because of all of these things and not knowing how to deal with it.
Great job, Danielle.
Next slide.
All right. Do they differ in adults and children? For hyperactivity, it may increase or decrease with age for children with ADHD. So the older you get, you might see a little bit more maturity and able to control that hyperactivity. The ability to stay on task and impulsiveness may increase over time when becoming a young adult. Literally can't stay on task half the time. It's the hardest thing. Children, the older they get, are expected to have more independence with school, causing their organization skills to decrease. So the more independence that we're expected for them, that could be really, really hard. Major increase in disorganization skills in adults, such as managing money, booking, attending appointments, forgetting stuff, and cluttered house and cars. We'll dive in more of that pretty soon. Let's see. For disorder and behavior, going more into the cognitive part, what you really will see is a lot of absent-mindedness. So like I could just be stuck staring off into space for many times. Like it just happens. Difficulty focusing, forgetfulness, having a hard time staying on task, paying attention for too long, hyperactivity and impulsiveness. That's common things you see. And then to the left, you can see there is a scan. I think it's an EEG of someone with ADHD and a normal brain, and you could just see how their level of, I think it's based off of, what is it based off of?
Simulation, probably.
Yeah, like if you can see the major change in that there for sure. Let's see here. All right, I'm just going to speak on the first part there, and then Danielle, you can go ahead. So for self treatments and healthcare, a common, no, actually this is not a common one, but when you see this happen, it can be healthcare can provide behavioral therapy to help people with ADHD and cope, overcome their symptoms, not just think that you're going to fix ADHD. You can't just fix it. It's how you kind of overcome it and deal with it. I do work with kids with ADHD, and some of the skills that we try to teach them is time management. So one thing I've done before is had my client try to manage the time. So always checking the time in between activities so they can hold themselves accountable to managing it. Plus breaking down a schedule and having a checklist. That's something I do every single day for myself. And then we do that in behavioral therapy to help them understand a schedule and a routine. All right, and then Danielle, did you want to explain the rest of that?
Yeah, so I think going along with that also, just the self-treatment, obviously, what can we do? Talk to your doctor. They will put together a list of questions, and then like Leah said, developing a routine. Combination therapy is always recommended, which includes the self-care, some sort of cognitive therapy or counseling, learning, like Leah said, how to manage your stress and time, because we all live in a stressful environment now and just probably forever. And then obviously exercise and meditation. And then if you and your doctor determine that you do need medication, then there is many medications now. I think what we are most used to here and have seen are the use of Adderall and Ritalin. Commonly, but there are a whole list, as we can see here, of
longer than this.
Yeah, newer medications. So, and then obviously eating right and getting enough sleep. So those are very important also.
Okay. And then let's see here. Yes, talk to your doctor. Oh, this is for you, Danielle.
So I think in conclusion, like we said, ADHD is a common disorder that's found in both children and adults. As we said, it can be started or seen as early as 7, they're saying, but I think I've read some stuff as early as 5, but I also believe also in personal things that I've seen that sometimes they're diagnosed too young, as early as 5, then they just continue to have different issues depending on medication and how they're dealing with things. So I think, like Leah said, 7 is probably the better age. Maybe your brain's a little bit more developed.
Yeah, and you also are
Children.
at that age where you are required to sit at a desk and learn from that way, and that's our norm, and that's something they have to overcome, and they have all that energy. So I think that's a good clarification of that.
Right.
And then we have a short explanation on ADHD we can watch.
I'm Dr. Ben Michaelis, and this is 1 Minute Diagnosis. Today I will be talking about attention deficit hyperactivity disorder, or ADHD, inattentive subtype. A person with the inattentive subtype of ADHD has difficulty paying attention or staying focused. They often feel restless and they give in to impulses easily. To be diagnosed with the inattentive subtype of ADHD, a person needs to exhibit at least 6 of the following 9 behaviors. They overlook or miss details, leading to mistakes at work or school. They have difficulty remaining focused during certain tasks or conversations. They do not seem to be listening or paying attention when spoken to directly. They have difficulty following instructions. For example, they may begin working on a task, but quickly lose interest, leading to unfinished duties at work or school. They are often messy, disorganized, and have poor time management. They avoid tasks that require lengthy attention, such as completing homework or reports for work. They lose essential materials like schoolwork, wallets, phones, or keys. They become easily distracted by things going on around them or their own thoughts. And they are forgetful when engaged in daily activities. For example, a person may forget to run errands, return important phone calls, or pay bills. And that's the inattentive subtype of attention deficit hyperactivity disorder in a minute. For more diagnoses, please visit drbenmichaelis.com.
So there we have it. In conclusion, wrapped up, these are our references and the information. If anybody is interested in checking it out, there's some good information there. Yeah. And we've enjoyed this, and we hope you enjoy it. And if you need to get with any of us, please do so.
Thank you.
Thank you.